Thank you for joining us for the Virtual Data Dashboard Demo webinar for stakeholders. I'd like to highlight a couple housekeeping items for you in Zoom. The features available to you can be found at the bottom of your screen. While the chat is disabled, we will be posting copies of either the presentation or additional resources, so you'll be able to download those or check those out at your earliest convenience. If you do have questions during today's presentation and demo, please type them into the Q&A pod, once again located at the bottom of your screen. Please note, not all questions will be answered in the order in which they were received. Thank you again for joining us today, and we hope that you find the webinar incredibly helpful. Now I'd like to turn things over to Deputy Associate Administrator Israel Ali. Israel?
Thank you, Carl. And good day, everyone. For those of you who I may not have had the pleasure of meeting during the previous engagement, my name, as you just heard, is Israel Ali, and I am acting Deputy Associate Administrator for the Bureau of Health Workforce here at HRSA. I just want to thank each of you for being here today and for your continued engagement with HRSA on workforce opportunities, not just through the National Health Service Corps, but the overarching effort to respond to the nation's demand for the health workforce. It's not lost on us that your time is valuable, and your presence here today signals a shared commitment to advancing equitable access to primary care services, specifically to rural and at-risk communities. Today's session is a continuation of the conversation we began during the NHSC roundtable. At that time, we shared the release of the National Health Service Corps Field Strength, and many of you shared an interest to delve more into the programmatic data. We heard you. And this meeting is our way of demonstrating that listening is followed by action. We want you to experience firsthand how the data we've made accessible for you can inform your work, strengthen your strategies, and ultimately benefit the communities and providers you support. Today's gathering is more than just a data demonstration. It's an intentional opportunity to come together and be transparent in what we believe is the current state of the health workforce and share how BHW investments aim to address barriers to care. Now, the stars of today's meeting will be Mr. Michael Denbeck from our Division of Business Operations and Mr. Steve Pagula from our National Center of Health Workforce Analysis. Together, they will highlight the various resources that we have made available for interested stakeholders like yourselves. The data you'll see today illustrates how far we've come and how far we have to go. At HRSA's Bureau of Health Workforce, we believe that primary care is sport. Like any great team, victory is only achieved when we collectively recognize, interpret, and potentially remove the barriers that stand in our way. So as we walk through the data today, I encourage you to see what it truly is and know that it's not just charts, graphs, and figures, but a reflection of people, students turned healthcare providers, patients who now have access to care, and communities that are stronger because of that. These are not abstract points on the spreadsheet. They are tangible and outcomes that we can all see as a shared mission. We welcome your thoughts, your questions, and your challenges, because a great team doesn't just celebrate the wins, it also learns from every day, every play, every shift, every pivot. This is a space that we can all foster open dialogue, build stronger relationships, and ensure that our efforts are intentional as our vision for the future. Thank you in advance for your partnership, your passion, and your presence. Together, let's continue to move forward and have data as a dialogue, and also make sure that we can shift our insights to impact and from our barriers to breakthroughs. So with that, I will now pass it over to Mr. Michael Denbeck to share some of our data resources. Michael.
Thank you very much. Good afternoon. Once again, my name is Michael Demick. I'm the Deputy Director of the Division of Business Operations in the Bureau of Health Workforce. And as Israel mentioned, I'm joined today by Steve Pagula from the National Center for Health Workforce Analysis. So we're going to walk you through some of the resources that we have available on the HRSA Data Warehouse, which is the access point for BHW data. We're going to give you a quick overview of each dashboard and then get into individual demos highlighting specific use cases. Now, the idea is for you to understand how to get to the data that you need and how to supplement the stories that you're trying to tell. I'm happy to take questions at any time, but we'll definitely have some time at the end to open it up for discussion. And I want to make sure that we get through everything so that you're aware of what's available. Some of the questions may not be able to be directly answered by the dashboards, but we can hopefully address everything through existing functionality across multiple dashboards, data downloads, direct data requests, or even future enhancements. We ultimately built these so that external stakeholders could unlock the full potential of our data assets. And everything that we did really focused on 4 key principles. We wanted to ensure transparency and access to data. We wanted to provide the ability to analyze the data that we have today. We want to build an understanding of the data through governance and create a culture that supports information sharing. So I'm going to very briefly go through these slides and then get into some live demos. These slides include all of the direct links to our available data with some brief descriptions for future reference. HRSA provides the public with extensive and easy to use data on health workforce programs, from dashboards on loan and scholarship awards to downloadable data on grant funding and information on health professions training program. Our mission is to strengthen the health workforce and connect skilled health providers to communities in need. Now, these first 2 slides right here just represent how to get the data, and I'm going to get into everything in detail in a minute, but I just wanted to just go real quick over these slides. This slide right here is a list of the actual dashboards that we're going to be demoing today. Each one you'll be able to link to directly. And then in the appendix is a list of all of the additional BHW related data, whether it's data downloads or other additional dashboards or data files. And so we will be sending out these slides after this meeting for your reference to get to all these directly. So I'm going to go ahead and just walk you real quick through a demo on how to get to the data, and then I'm going to hand it over to Steve. So to get to the data, this is data.hrsa.gov. Will take you to the main page with all of the HRSA related data. Today, we're going to focus on BHW data. So to get there, you click on topics, and then you go here to health workforce. So this is the main page for all of our BHW related tools and data, and it's broken down into 4 different sections. The first section is health workforce shortage area, BHW program data and tools, the National Center for Health Workforce Analysis or NCWA data, and then National Practitioner Data Bank. So at this point, I'm going to hand it over to Steve, and he's going to walk you through 2 very important dashboards under NCWA, which are the projections dashboards and the nursing dashboards. Steve, go ahead.
Thank you so much, Michael. It's a pleasure to be here with everyone today, and I wanted to echo something as I'm bringing up my screen to share, which I hopefully will be able to do shortly. That both Israel and Michael mentioned, and that was, it's so great to connect with folks who are using these data for important purposes. It's very easy to get lost in all the data that's out there, in all the data that we have in our everyday lives, but at its base and at its real essence, data is helpful for us to make good decisions. And what we want to do is to put as much data as possible out there to folks like yourself so that you can make the best, most well-informed decisions when you're deciding, let's say, how to use scarce resources or how to direct resources. We want to put that information at your fingertips. So I'm hoping that I'm sharing my screen right now. If somebody could maybe just give me a thumbs up to make sure I'm doing that. We have let me start with our nursing dashboard. So our nursing dashboard comes from our National Sample Survey of Registered Nurses, which is a very large sample survey that we conduct every 4 years and looks at all aspects of the registered nurse workforce, everything from demographics to their work environment, to their training, to their wages and hours. And this dashboard visualizes over 400,000 unique data points from both our 2022, our most recent NSSRN, and our previous version, the 2018. So I'd just like to step through briefly to give you a general idea of the type of information that is available. So, for example, on this screen, we have demographic information, and you can see there's cuts by age group, by race, ethnicity, by the sex of the nurse. We can also look at it this is defaulted to the all US, but if you wanted to look at it for your state, I'll just pick Louisiana. It should automatically update to Louisiana so that you can take a look at that. There's also different types of license types that we have data for. So if you're looking for all RNs, maybe you were interested in nurse practitioners or advanced practice registered nurses, or maybe RNs who weren't APRNs, you can select those and get data for them as well. And then finally, we can look both at the licensed workforce for RNs and the licensed and employed. So you can look at it for both, in both ways, in either way actually, to hopefully zero in on the group that you would like to reach. So I mentioned some of just the overall numbers right here. When it comes to demographics, we even have things like languages spoken, veteran status, which can be very, very helpful when you're looking at the workforce. But we also have data on education and licenses. I'll switch over to that tab briefly just to talk about what's there. On the education and license, and let me just switch back to all US right here, you can get a sense of the initial degrees of RNs. The largest number of RNs now are coming in with bachelor's degrees. You can see the average age at graduation, different things related to the educational licensing here of RNs. One point, or one important one that I wanted to mention specifically, was the location of the education. You can see that here for our nursing degrees, and also the source of financing for educating RNs. So there's a lot of different ways that RNs are financing their education, and it's a really important dimension to consider when we're supporting our RN workforce in that respect. So next up, just some employment data. If you were interested in where nurses are employed, you can take a quickly look at this map to see where they're distributed across the United States. You can also see, are they part-time, full-time? Is there any secondary employment? The type of employment, which I'll highlight just briefly here. There's been an increased interest in travel nurses. About 5% of the nurses that we found in our 2022 NSSRN identified as being a travel nurse. That was up about 5 times since or about five times larger than our 2018 data that we had. In terms of work environment, there's also some very interesting information here, both in terms of the employment setting, which I'll show you down here. So if you were interested in learning more about where nurses were working, you can actually click on this. If you were looking at outpatient and clinical sites, you could see the detailed setting that they have right here. Or if they were looking at hospitals, not mental health, different types of the data that comes from our NSSRN. We also have some information here that's new to the 2022 NSSRN, things like COVID conditions, burnout, and also some expanded data on telehealth usage. One final thing that I wanted to highlight on the NSSRN or on this dashboard, bypassing the earnings and hours, which are fairly self-explanatory, is this page, which it's great to look at both the 2018 and 2022 side by side in some cases to see where things have changed. So, for example, here you can see on the race and ethnicity, it's the number of, or the percent for the white non-Hispanic workforce, or the number of non-Hispanic white registered nurses has actually decreased from 73% in 2018 to 67% in 2022. And this visualization helps you see that quite easily. And one final thing that I wanted to highlight on the nursing dashboard was we do have data on rurality. And so if you were interested in, let's say, the breakdown of nurses by rural areas, by the sex, by their primary position, by their race and ethnicity, and also just by some practice information that they have, that information is right here. And again, this can be you can look at this for 2022. We even have 2 different ways to define rurality: the RUCA codes, and also our definition put forth by our colleagues in the Federal Office of Rural Health Policy. So with that, I will move on to a second dashboard that I'm looking forward to highlight for everyone. This is our workforce projections dashboard. So I just refreshed that to make sure that it would come up. But our workforce projections dashboard visualizes the workforce projections that we publish each year. And in fact, we just put our latest workforce projections out in late November. So these are still relatively new. We publish projections data on the supply of and demand for over 100 different occupations in the healthcare workforce. And the unique thing about our projections is that it does include both the supply and the demand. If you only have supply projections, which there are other supply projections out there, it can be difficult to, without the demand, it's difficult to contextualize that number and say, well, are we doing well? Are we falling short? So with both supply and demand, we can calculate things like shortages or surpluses. And the data that we have here is not only for the 100 different occupations, we can also look at it by state. So if you're interested in things by a particular state, you can visualize that and look at it in the map. It's also over a 15-year period, so we can look at individual years within that period. Our projections run now from 2022 to 2037. And you can even do things like for certain occupations where we're able to generate it, you can look at rurality. So metro areas versus non-metro areas. And in most cases, non-metro areas are showing showing less supply than in metro areas. So let me take you through just a very, very brief example here. I like to use general internal medicine physicians as my example. So if you were interested in let's say any occupation, you could look at our main page here, our supply and demand trends. So you can see our starting supply of 88,610 general internal medicine physicians in 2022. We were going to see an increase of a little under 3,000 to an ending value of 91,570. However, our starting demand for general internal medicine physicians was 101,000, and it increased quite a bit, up to 120,000. So we are showing a percent adequacy of 76%. And the way you would interpret that percent adequacy is it's the supply divided by the demand. And you would read that as in 2037, that's our last year here, in 2037, the supply of general internal medicine physicians in the United States is going to be sufficient to meet only 76% of the projected demand. And if you look, let me just highlight the metro, non-metro here. Metro, it's a little better at 80%, still not great, but a little better than the national average. However, that means in the non-metro areas, it's quite a bit worse. So in non-metro areas, there's only 42% of supply is going to be met by the 42% of the demand, is going to be met by the projected supply in 2037. And you can do this throughout over 100 different occupations. We've got over 30 different physician specialties. There's registered nurses, licensed practical nurses. There's over a dozen occupations in behavioral health, long-term care, oral care, and women's health. So there's a ton of different occupations that you can look over. I mentioned the map, and one other thing that I did want to mention is in this dashboard that highlights some of the data we produce is what we call our what if scenarios. When we're doing any type of projections, there's an art and it's a science. So the art would be deciding which, say, assumptions you want to take or which data sets you sort of want to use. And we know that there are different ways to go about doing it. So we try to do what are called alternative scenarios, which would show, well, what happens if we take one of the assumptions that we made and tweak it a little bit? So for example, what would happen to supply if providers decided to retire 2 years earlier or 2 years later? What would happen if more graduates came in or fewer graduates came in to the workforce? Well, we have those data right here so that you can see that. In addition, we have some demand scenarios, which I won't go into detail here, but perhaps if folks are interested, I can go in the Q&A that show what would happen if if everybody used services at the same rate as a particular group did. So for example, in those who the insured population generally uses services at a higher rate than the uninsured population, what would be the change in demand if everybody used services at the same rate as the insured population that we have? So all those are contained in our workforce dashboard. One thing that's common across both of our dashboards, our nursing dashboard and our workforce projections dashboard, is that you can download the entire data set if you would like, so that if you like what's in the dashboard, that's great. But some people like to get their hands on the data and work with it themselves. It's there as well. Again, one of our big goals here in BHW is to make sure that we're meeting folks where they are with their data needs so that they can use that data to make the best decisions possible. And with that, I will stop sharing my screen and hand it back over to Michael. Michael?
Thank you, Steve. Let me go ahead and share my screen again. All right. So Steve went over to the dashboards that were available under the National Center for Health Workforce Analysis. So just to give you guys a little bit of a idea of where we are right now. So this is the main BHW data page. I briefly mentioned that we have 4 different areas of data that we have. So now I'm going to be focusing on the Bureau of Health Workforce Program data and tools. I wanted to mention here that this data is broken up into 2 main groups. So we have data on grants, training, and school loan programs for organizations. And then if you scroll down, we have data on scholarships and loan repayment programs for individuals, specifically with NHSC, Nurse Corps, and more. I'm going to be going over these particular dashboards today. We also have a lot of available data as part of our data downloads. And I did want to mention that at the bottom here, there's an email address, bhwdata@hrsa.gov. If you do have any questions, feel free to reach out to that inbox and we're happy to help. So the first dashboard that I want to review today is the field strength dashboards. So these dashboards include related data information for National Health Service Corps, Nurse Corps, Substance Use Disorder Treatment and Recovery Loan Repayment, which is the STAR program, and the Pediatric Specialty Loan Repayment Program, which is the PSLRP program, along with participants, students, and trainees information. Now, the overall purpose is to show participants who are currently fulfilling their service commitments at approved healthcare sites as of September 30th of that prior fiscal year. Now, this is important because it's a snapshot of the data from a specific point in time, which is right at the end of the fiscal year. Now, the newly updated field strength data was actually available in October. However, we just updated this new fiscal year data on these dashboards on November 15th. So with these dashboards, you can analyze results for specific subsets of data by filtering on various program, location, shortage designation, and site attributes. And on the Students and Trainees tab, you can gain insight into the disciplines and school locations of future clinicians preparing to serve in high-need communities across the country. You can see participants in the NHSC Scholarship Program, NHSC Students to Service Loan Repayment Program, and the Nurse Corps Scholarship Program. So now I'm going to walk you through a specific demo. Before I get into the details of the dashboard, I wanted to point out a couple of things. So on every one of these pages, kind of like a hosting page, you're going to see very similar information. So the main part when you first get in here, it just gives a general description of each dashboard. You also have the About This dashboard right here, which is a PDF. So if you click on that, it's going to give you additional information about the dashboard, which may include definitions or different formulas, depending on how the dashboard works. And then at the bottom here, you have the ability to download data. One thing I want to mention is that we are limited with what we are allowed to give out in terms of data. So you're not going to find any PII or anything that is really identifying individual people. It's more about the aggregate data that we have available. But this whole data download page is available for all the different dashboards. All right, so let's go ahead and walk through a specific example here. So this is the main Field Strength Explorer page, and this is going to give you details on current field strength, but let's go ahead and start filtering it down. So I want to look at fiscal year 2024, and we're going to look at the NHSC LRP program. And then I also want to look at site types that are NHSC FQHCs. So when I do that, you see the numbers start to shift. So now we're looking at about 5,800 people. And then this box here, you can see the different clinician disciplines that we have available, whether they are serving at rural or non-rural sites. And then there's additional information regarding the different states, and then a map you can go. I'm going to go a little bit deeper. So let's go to rural status of just rural. And then I want provider type to be just mental health. So now you can see based on this, these filters that I put out, now we're looking at 252 total people. And then you can see over here the different numbers that we have and how everything is adjusted. In the map itself, if you hover over the map, you can see data on that specific state. Now, what you can do though is you can compare, different years. So if you look at this exact same filter that we have, but through different years, you can see how the numbers fluctuate. And for any given year, you can go down and look at the adjusted numbers. If you click on the Field Strength Explorer County tab up top here, it keeps the same filters, but it just allows you to go a little bit deeper. So if you wanted to look at the very specific counties, you can go ahead and click on the county. It'll give you the county name and then the details for that county for specific field strength. On the Students and Trainees tab, this tab focuses on scholars in school, post-grad training, or in site placement process who will be in service in the future. So now each fiscal year shows the total count of scholars in school as of September 30th of that year. So let's walk through another specific example here. We'll look at NHSC and we'll look at the scholarship program. And then let's look specifically at dentists. And you can see here now we're looking at 806 total students or trainees. And then here is the breakdown per state. And then you can see the map. And then you can hover over and again see the different stats for each one. As I mentioned before, you can download the actual data. In this scenario, you can pull up whatever data you want related to the field strength, but just to give you guys an idea of what that looks like. As I mentioned, it's really meant to be more of an aggregate look. Now, depending on the dashboard, you might get some different data, but we provide these to, so you can look at the data and get the total numbers and, kind of dive into it a little bit deeper if you want. So that's the first field strength dashboard. I wanted to highlight just a couple examples and then get into just so you guys can see kind of how they're meant to work, how you can really start to dig down and find different numbers based on the filters that you select. Now I'm going to go into the next one that we have, which is the alumni clinician dashboards. Now, the main premise behind these dashboards is simply, do clinicians work in a HRSA or serve the same community where they completed their service? Now, we created several dashboards to offer information related to the retention and distribution of BHW program participants. We worked internally on the governance to define this concept of retention, and we broke it down into two different categories. So we have community and we have HRSA retention. So do they still serve within a HRSA or in the same community where they completed their service? So what do we mean by community? This could be the same county, same census tract, or the same site. Now, these dashboards include alumni retention data for NHSC and Nurse Corps loan repayment and scholarship programs from fiscal years 2012 through 2023. Now, we do this by using the NPI number to match the CMS publicly available data to help determine a clinician's last known work address. One of the main known concerns is that the data from CMS is not updated in a timely manner. That's why, or could not be updated in a timely manner. So that's why we utilize our shortest designation management system to get the best possible address that we can find. So by leveraging the hard work of our state primary care offices, we can override an outdated address from CMS with a current one by PCOs on the ground working in their communities. And we're also working on two projects, one using artificial intelligence and one with a research partnership to help us determine the best address, or at a minimum, a confidence level of our existing addresses. So to walk you through a quick demo here, I want to highlight the first dashboard here is the executive dashboard, which includes all the programs. The bottom line here is that all of the data is broken down into different types of retention. So for this one right here, you have the retention across all years. So we're looking at 82% of people currently working at HRSA. Now, there's lots of numbers on this on these dashboards, and I want to just kind of quickly walk through them. So we have 48,353 total clinicians who completed their service between 2012 and 2023, but we don't have MPI or good data on a lot of those people. So we're looking at a total of 34,848 total records that have an MPI that we can potentially track. And out of those, we have 26,900 where we know, the location, and we're confident that we are able to ultimately track them. So out of that 26,900, 82% currently working at HRSA. Over here on the right, you've got community retention. So 86% currently working at HRSA or within the same community. And then over here is your rural community status, not to be confused with rural retention. So rural community status is just, are they currently working in a rural community? Not, did they work in a rural community and are they currently working in a rural community? So this is a breakdown here of the different years by the two types of retention, HRSA retention, and community retention. And down here at the bottom is a breakdown of the different states. So I want to walk through a specific example, and we're going to go to the detailed retention analysis page. And on here, let's go to, we're going to click on all of the NHSC programs. So we're going to do LRP, RC, SP, and SED. And when we do that, you see now we're looking at a potential of 31,000 records. And out of those 31,000, we're looking at 82% that are currently in a HRSA. But let's dive down a little bit further. So let's say we want to look at just Hispanic. And so when I do that, you can see that the rates change. So the important thing with this tab is that you have 78% that are in a HRSA. However, we've broken down the retention concepts all the way down. So you can see under the legend here, you've got not in a HRSA, but at the same site, not in a HRSA, but in the same census tract, not in a HRSA, same county, not in a HRSA in a different county. So really, if you think about it, the only not good retention that we're talking about is not in a HRSA and in a different county, and that's this gray area right here. So everywhere else is potentially a positive retention concept. Over here, you have the rural status of the selected clinicians, and then just a breakdown of the different years. Let's go down a little bit lower so you can see how things shift as we get as we dive in a little deeper. So let's look at just dentist. And so when I select dentist, now we're only looking at 391 people, but you can see that retention rate is 55% in a HRSA. But then when I switch to nurse practitioner, you can see how that changes. And so now you're looking at 87% out of 692 different people. So as you're going through these different filters, you can really dive down and see what may impact retention. I want to take you to the map dashboard here. So the map dashboard is going to show you where clinicians completed their service and where they are now. You have to select at least a program and a state to start. So let's go ahead and select NHSC programs again. And now let's pick the state of Tennessee. Oops. Tennessee, and click apply. All right, so now you see that we have 554 people that fit that criteria, and 89% currently work in a HRSA, 90% currently work in a HRSA or within the same community, 36% are currently in a rural area. This image right here shows you the where they are now locations. And when you hover over each circle, the bigger the circle indicates the more people. and it'll give you a different breakdown of the statistics. So you have the different HRSA categories and the different program breakdown. So it just gives you a visual of the where they are now. I wanted to highlight here that we have the CD stands for congressional district. So we have a service completion congressional district filter and also a current congressional district filter. So under the service completion district, let's walk through. Let's select Tennessee. We're going to go just District 1. So now we're looking at everyone who was in an NHSC program that completed their service in Tennessee from District 1, where they are now. And you can see we've got 64 people and 98% currently work in HRSA, 98% currently work in HRSA or within the same community. One thing I wanted to note is the breakdown here. This is the current locations of the clinicians. So you can see they're not, they completed their service in District 1, but they may be in different districts. One thing I did want to point out is the map did not change. That is something that we are working on getting updated. So in a near future release, the map will also show the distribution of people via congressional district. And just to kind of show you the difference, we're going to look at one more state, and I'm going to clear out the congressional district filter, and we're going to select the state of Massachusetts. I'm going to click Massachusetts. These are people now who've completed their service in the state of Massachusetts. You have 46% currently working at HRSA, but 70% currently working at HRSA or within the same community. And here is the picture of the distribution. You can see, as expected, a lot more in the Northeast. And let's look at, narrow it down a little bit more, and we're going to go to clinician discipline. We'll do physician assistant. And when I do that, you see we're only looking at 34 people. However, you can see how the different retention percentages have changed. Okay, so now I'm going to walk you through the program applicant dashboards. So the program applicant dashboards, let's see here. The program applicant dashboards, these are for information and data related to the total number of eligible applicants and awardees. So you can use these dashboards to view applicants and awardees of loan repayment and scholarship programs for fiscal years dating back to 2020. You can view demographic, discipline, provider type, site location, different data for NHSC STAR, pediatric specialty, and nurse corps program applicants and awardees. As I mentioned earlier in my overview, you can use different combinations of dashboards to answer questions. So this is separate from field strength. This is separate from retention data. This is strictly based off of the applicants and the applications. So let's look at a specific example. We'll stay with fiscal year 2024, but for here we will select Nurse Corps LRP. And so you see for Nurse Corps, what we're looking at here is 6.4% of everybody who applied was awarded. So we're looking at 377 people out of 5,800 eligible applications. And then you can see how it's broken down into different areas, whether it be by race, ethnicity, disadvantaged background, and then you have a different breakdown of all the disciplines and specialties as well. You can see here, nurse practitioner has different percentages, and you can see the numbers are pretty high over here. Let's switch to NHSC LRP just to show the difference here. So for NHSC LRP, you're looking at 54% of everybody was awarded. And again, the numbers will adjust everywhere else as well. Let's look at location by county. And so this is the same view of what we had before, just broken down by county. But let's narrow it down and we'll look at just the state of West Virginia. All right, when I do that, you can really see the difference in numbers. And it's broken down by all the different counties as well. When you scroll in on the map, you can hover over a different county and see the different percentages that have been awarded and submitted. And then at the bottom here is your rural status, so submitted, eligible versus awarded. Okay, I'm going to take you through the BHW footprint map now. All right, so the BHW footprint map is an interactive Esri mapping application that provides a comprehensive view of BHW assets. These assets include program sites, in-service BHW program participants, submitted eligible BHW applications, health professional shortage areas, congressional districts, and other relevant workforce data sets. Now, when I walk through this, I want to point out that all of these layers act on the left here, they all act as.
We can hear you fine, Michael.
Okay, great. Thank you. I just heard that it restarted again. All right, good. So the different layers here, I wanted to point out that they are all independent layers, which means you turn them off and on and they just kind of go on top of each other. So they're not tied to each other. There's really not any business logic that goes into it that makes filtering like the other dashboards. This is a little bit different. So it's just going to give you a map of all of our BHW assets. So let's look at, I'm going to start to kind of narrow these down here. So let's look at in-service BHW program participants. Now actually for this map, I'm not going to open it up, but about this map gives you details and definitions for each of the layers. And this one right here is important because it's in-service BHW program participants. It's not the field strength. So in-service BHW participants, this is updated daily. And this is meant to give you a current view, not necessarily the official field strength for a given fiscal year. So we're going to look at just NHSC participants. And then I want to look at active BHW program sites, but only NHSC sites. And you can see when I do that, the map is getting updated. Up here, I can filter out some things if I want to. So I want to look at NHSC active sites that are American Indian health facilities. So now when I did that, you can see that there's currently only dots. These dots represent the different NHSC participants. If I click on a legend, it'll tell me what these are. So the squares represent the sites, the circles represent the participants. As you can see, I filtered out by Indian health facilities. There aren't any in the Washington, D.C. location. But let's go ahead and start to zoom in a little bit here in Oklahoma. And you can see that now we're starting to see some of these squares. So let's zoom in around Oklahoma City here. And I want to also add some other layers to this map. So let's look at submitted BHW program applications. And I only want to see NHSC LRP applications. And then let's look at HRSAs. And I want to make sure we look at all of them, mental and dental and primary care. And then I want to see congressional districts. So now when I've added all those layers, as I zoom out a little bit, you can see that all the different layers are there. The further out you zoom, it gets it gets to be a lot of data. So if you start to zoom in on a specific area, you can start to see how that differs. So let's zoom in on this area right here. And what I want to do is click on one of these, and then it pulls up the information for everything related to that spot on the map. So here you can see that we have multiple NHSC participants. So this first one right here, this is one of kind of 8 pages related to that point on the map. So it'll give you details about this particular participant. In this example, we have 2, 3, 4, 5, 6, 6 different participants there. And then here's information about the site itself. You see it's an American Indian Health Facility. and then you can see information about the mental HRSA that it's in. So it gives you information about the HRSA itself. If I click down here on this attribute table, I just wanted to highlight this a little bit if you're getting into the data. What this does, it gives you all of the data related to what you're seeing on the map. So if I zoom out, you're going to get more rows of data. You have different spots here where you can look. So this is the data that we have available for NHSC participants. You have the nurse core, star, and then you have the different sites. If you want to see all of the data, you'd click on this filter by map extent, and you can bring up all the data, and then you can export all of it to an Excel spreadsheet and do a little more. As I mentioned earlier, you're not going to see any PII or anything really specific, but it's a way to export the data in an Excel format and be able to manipulate it some more. The other thing I wanted to point out here, if you really want to dig deep, you can get into this filter and you can add expressions and really start to filter out the data to find exactly what you're looking for. I'm not going to get into that right now, but that feature is available. So the last thing I want to do here, I'm going to click again on this site, and you can see right here it says site profile, right? So we're looking at the NHSC site, Oklahoma City Indian Clinic, Ann Arbor Clinic. And then I want to click on this site profile URL. So now what this does, this opens up the Health Workforce Connector. And I wanted to highlight this tool because it's an important tool that's used to connect skilled clinicians to communities in need. It's not necessarily a dashboard or a data-specific tool, but it is an important tool that site POCs use to help recruit and connect to clinicians who want to work and serve in underserved areas. This tool, it allows approved HRSA sites to actively recruit these clinicians and students to work in underserved areas. And end users can create and publish profiles. They can search for sites, they can locate open job opportunities, and they can connect with site point of contact at healthcare sites. So I just opened up that one site that we had in there. And you can see here, this site has 2 open opportunities. You can find more information about this site. So this is all information that they have input on the site POC's input on the About Us section. And then there's also a lot of information about the site itself. So what type of site is it? What are they currently NHSC active, different program approved services? This link right here takes them directly to the site's actual website. If I click on opportunities, you can see the different opportunities that they have available. So this one here, you pull up the physician opportunity. It gives you details about the actual job posting that they have. Now, if say I'm a job seeker, if I'm interested in learning more about this site, or I want to connect with this site, I can connect with the site through this button, and it basically creates that connection so that you can interact with the site POC. Going to the Health Workforce Connector homepage, this is where you could go to search and find different sites. So I'm just going to walk you through a real quick demo. Let's look for physician, and when I pull that up, you see that we have 4,630 sites and almost 4,600 open opportunities that have the keyword physician somewhere in their profiles. Let's break this down a little bit more, and I want to look for only rural health clinics. And let's look at sites that are officially labeled as rural. And when I do that, you see we have 605 sites. There's a list of them all here, and you can click on any one of them and bring up that site profile, or you can do it from the map, and you can specifically get into these different pins, and then you can open up and then go to the profile and learn more about them. So I wanted to highlight the HWC because I think it's an important tool, the mission of BHW. And all of these, and I also wanted to show that kind of all of these different dashboards and maps, they're all related, and they can all be used together to start to answer those questions and tell those good stories around BHW data to hopefully, strengthen the cause for what the actual health workforce needs. So I think at this time we can open it up for questions.
Michael, are there any specific highlights available for the pediatric healthcare workforce?
So for anything related to pediatric, so we have different, as I mentioned in the some of the demos, the pediatric specialty LRP program is listed as one of the programs. So anytime you see a program filter, you should be able to filter down on that specific type of program. So just an example, you get into here and under the program, you should see PSLRP. So then you're filtering down onto all the data related to the pediatric specialty program. The other thing that I wanted to mention is that pediatric disciplines are listed as a specialty. So as I went through some of the examples before and we talked about like selecting a dentist or physician assistant, if there's a subcategory or a specialty of that's available to filter on, you can also filter out on pediatrics there. So wherever that specialty filter exists, you can filter out on those specialties. The clinician dashboards, for example, in the clinician dashboards, that detailed retention analysis tab, you can select pediatrics as a specialty.
Nitra, if you'd like to raise, Nitra Johnson, if you'd like to raise your hand, you can go ahead and raise your hand and ask your question. While we're waiting for Nitra's question, can you talk a bit about when will you add nurse practitioners and physician assistants to the unified alumni dashboard?
Sure. So I didn't review the unified clinician dashboards, but just to walk you through it real quick, let's go back to here. I walked you through the alumni dashboards, but not the unified dashboards. Give me 1 second to bring it up. I'm sorry. So I walked through the alumni dashboards, the unified dashboards I didn't cover, but it's also same concept overall, except that it's not as focused on retention. It's more just about the concept of where they are now, because we added in additional programs that don't necessarily focus on retention, but we felt like if we can track the where they are now, it could still be helpful. So for the unified dashboards, we also brought in the THC-GME and the CHGME programs. And then you can see the different breakdown of where they currently work, whether it's in a HIPSA or a MICTA or a medically unreserved community. So with these dashboards, you can still filter these out. So we do have the ability to filter out on nurse practitioners and physician assistants. So again, anywhere where you see a program discipline, in this case it's program profession, you can filter those out. So you could go and look at just nurse practitioners, for example, and then the data will adjust based on your filter.
Hi, this is Anitra.
Hey, good
I have a
afternoon.
question about the nursing workforce dashboard. With the data that you display, does it break down or do you even collect data from nurses who obtain their degrees in other countries but are working in the US?
Absolutely. In fact, if I could share my screen real quick, I could show you, I'd be happy to show you that. So
Thank you.
let me do that. Thank you very much for your question. And yes, that's actually one of the sort of emerging topic on the nurse side right there. And let me go back to the nursing dashboard under education and licenses. If you were interested just in seeing the total number of where they got the degree that qualified them to be a nurse. So let me just do a quick refresh here. And but while that is refreshing, yes, we do collect data on where they were educated. And one of the striking things is that, unsurprisingly, when you look at it on a state level, if you were, let's say, educated in New York, you are pretty likely to be practicing in New York. But it's pretty consistent the whole way through. And I will just pull it up right here. And especially for our 2022 data, foreign country educated is almost always in the top 2 or 3, sometimes top 5. But here you can see that in the entire United States, the largest number of nurses got their initial nursing degree in New York, followed by California, and then it was either foreign country or US territories. So we do have those types of data available that we're showing in the dashboard. And one other thing that I can just mention is that this dashboard is populated with data from another data set that we have up online from our NSSRN. It's called our public use file, or PUF file. And we're just scratching the surface with some of the data that we have that we're visualizing here. So if you were really interested in, let's say, those who got their initial degree in a foreign country, you could go to the PUF file and do some analysis of the data there and run your own analysis if you were really, really interested. But I think that highlights a nice aspect of this dashboard, is that it gives you some kind of top level data right here, that 6%, let's say, of the nurses in the US in 2022 got their initial degree outside of the US. And if you wanted to do some more exploration or dig into the data a little bit more deeply, you could do that with our PUF file that we also have up online.
Thanks, Steve.
Absolutely.
Okay, so we have another question on about the dashboards. Can one of the dashboards be used to calculate the number of medical schools or other healthcare programs in a specific rural area?
Let me think about that one for a second. So, so from the field strength dashboards, the answer is no, but other dashboards, may have a combination of what you need. So in order to do something like that, I think you really need to go, that's why we gave you that full list of, when we send out the slides, you'll have the full list of all the resources available. Because you kind of a combination of all that, you will be able to get at least an idea. So some of the things that may be helpful are the Fine Grants dashboard that we have listed there, or even the health professions training programs could get you some information you might need, along with the footprint map. So is there an easy way to specifically do that right away? Not within the dashboards that we just showed you, but there are ways to kind of use multiple dashboards to get to that answer.
If we're interested in forming a partnership with a healthcare center in a rural area, which dashboard or resource would give us the best information about rural sites and their workforce?
I think that the best way to do that is with the Health Workforce Connector. So that's one of the reasons why I really wanted to walk through that with you, because sorry, I want to look up a little more information on that one. Because we've had different conversations with site POCs, and they've really indicated how difficult it is to recruit in underserved areas, especially in rural areas. And so we created that tool to make it very easy to connect, to make that connection. And so it doesn't, a lot of people think of it as a job site, but it's really not. It's about making those connections. And, as I went through that demo, I kind of showed you how you could find that one particular site in Oklahoma City, but you could also find different sites that are specific to, an area of the country or different programs. And then we have the mechanism there that you can actually reach out to them and make that partnership, or at a minimum, learn more about that site, either from the Health Workforce Connector or from their website that they may have published. And so it's a really good tool to be able to start to see what is available out there.
Great. If I need to demonstrate how the healthcare workforce has changed in our congressional district in the past 20 years, how would I access and calculate that data? How far back in time do the dashboards go?
So each dashboard is a little bit different. The best way to do that is through the fiscal year, or the different, fiscal year, that we have. So it depends on the data. It depends on the dashboard on how far back the data goes. So, the clinician tracker dashboard, for example, goes back all the way to 2012. Some of the other dashboards only go back to 2020. So it really depends. Congressional district, we currently have the congressional district filter on our BHW footprint map, and then also available on the clinician tracker dashboard. We are going to be adding it to the field strength dashboard and also the program applicant dashboard. So we want to be able to filter out the data, or at least to see the different congressional districts in every dashboard or map that we have. But we don't have those completed yet, but those are coming. And you will be able to filter out on that and to pull out the specific information you're looking for.
I think you spoke to this a bit already, but how would I use the dashboard to identify the number of HRSA and HSC scholarship awardees that are currently serving in my community?
So the best way would be with the field strength dashboard. That's where you're gonna see the official count that we have for specific fiscal year. That's the official count based off of the snapshot in time from the end of the fiscal year. But if you're looking for kind of a different picture, you can also go to the BHW footprint map, where you can see the people that are currently working there. And again, that is updated daily. So it really depends on what you're looking for. If you're looking for the official number that is provided once a year, or if the actual current number that we have right now, that's a little bit different of a number, but that is also available.
Can the dashboard help me access the same type of data for other BHW programs?
I'm sorry, can you repeat that question?
Can one of the dashboards help me access the same kind of data for other health workforce programs?
I guess which programs? I'm sorry.
Nurse Corps.
Oh, right. Yes.
Yeah.
Yeah. So you definitely break those down into all the different programs. So all the program filters is where you can go. Every dashboard is really broken down into different programs. So that's kind of the starting point for every dashboard and map, is which program you want to look at. And they're set up so that you can look at all of them at once, or you can break them down into specific programs.
Can the dashboards be used to drill down to race and ethnicity by discipline? For example, the number of Nurse Corps loan repayment awardees who identify as African American. Can you sort by gender as well?
Yes, so most of our dashboards have the ability to filter on race, ethnicity, and or gender. However, this information is self-reported on our applications, so it may not be 100% accurate or available for all participants. But as long as the filter exists, you can filter down the data to very specific data sets. So one of the examples I walked through earlier, we were looking at, I believe, the retention rate of Hispanic specific people. And so that is definitely a way we can filter down if it's reported. Now, you're not going to get that data on everyone.
I know that pharmacists are eligible for only some of the NHSC programs. how can we utilize the dashboard to see which BHW programs include pharmacists and where those awardees are located nationwide?
Sure. So pharmacist within our data is considered a discipline. So to get this answer, you'd go to the field strength dashboard. You select pharmacist from the discipline filter, and then you'll see which programs have field strength with that discipline. So we don't have specific within our data. We don't have programs that are identifies as pharmacists. So it's really it's one of those discipline filters. So hopefully you kind of got that understanding of how to use the dashboards and how to break down the different filters so that you can see the different data. And one of the important ones is definitely that discipline filter, a discipline and specialty filter, where you can really start to narrow down the type of data that we have.
Those are all of our questions at this time. If anyone has any other questions, please put it in the Q&A pod or feel free to raise your hand. Okay, I will turn it back to you, Michael.
Yeah. So I don't know if Israel would like to close this out, but I'm happy. I just want to say thank you again for giving us the opportunity to walk through all these different dashboards. And Steve, thanks so much for taking the time to walk through the projections and the nursing as well. As we mentioned earlier, we have the BHW data at HRSA.gov inbox. So if you do have any additional questions, please feel free to reach out to us directly. We have a whole team of experts that can help out. If you have specific questions, we can help you get what you need. As I mentioned earlier, with across all different dashboards or even direct data requests, or if it's something that we don't have in that we should have in, we could potentially build it out as a feature enhancement. So thank you so much for giving me the opportunity to walk through these dashboards, and I'm gonna turn it over to Israel.
Thank you, Michael. And again, thank you to Steve Pagula. Again, as I mentioned, they are the stars of the show today, but also the other stars are all of you. We see this as an opportunity to continue to build on. As you can see, we have a rich data set and a number of opportunities to really address many of the concerns, questions, and even interests that you have as it relates to our health workforce program. If I'm not mistaken, we will be sharing a recording to many of you, to all of you who've registered for this event, because we don't want the conversation just to be left here. We do want to make sure that we give you all the opportunity to go through these dashboards yourself, being intentional around what you want to find from our health workforce data, and then ask questions. As I know Michael earlier in the segment today referenced our email address, where if you have questions about our data, that's where you can go find out. Maybe we need to do some improvements to the resources that we have available, and we're really open to that. This data set, all of our data sets are intended to be a resource for all of you as well as our internal staff. So we want to make sure that we have the same stream of music that we see when we're making our decisions and our programs, and making sure that we have a collective effort on what we're trying to accomplish. So with that, again, I want to thank you all for taking the time out today, for joining us, and we look forward to the next opportunity that we have to engage with each of you. So thank you, and have a great rest of your day. Bye.